Okay, we finished up with consents. Now we're going to get into some other aspects of the med legal stuff for the EMT basic. Forcible restraint. Unfortunately, there are times where we have to forcibly restrain somebody in order to take them to the hospital. You guys will get plenty of training on this when you guys get into your respected services. But yes, sometimes this is necessary. Okay. Usually we do get orders from what we call the MSEP, or the Medical Control Emergency Physician. This is for people that might be not acting right, might be on some kind of altered substance, right? Somebody that is not alert and oriented to person, place, time, and events, and could be combative with us. They could be a danger to themselves or others, okay? And we actually have to force them to the gurney. At the EMT basic level, you guys are only allowed to physically restrain. Most of the gurneys have a set of wrist straps and a set of ankle straps in order for you guys to strap them down to the gurney in order to protect yourselves. The medics are able to actually use sedation medications, what we call chemical restraint, in order to possibly render that patient unconscious, in order for us to protect ourselves and the patient themselves. So with forcible restraint, it is permissible depending on the state. I don't know any state that's not able to forcibly restrain. What I think they mean by that is some states let the police handle it, the law enforcement handle it, which technically should be the ones that are handling it. And some states, like the state of New Mexico, like the emergency medical services to handle that for them. Whenever possible, we want to spread the liability in EMS, okay? We want to get a doc on board. We want to get our medical control doctor on board and consult with that doctor, okay? This patient might be agitated. This patient might be on some kind of mind-altering substance. They might not be alert and oriented times 4. As soon as that doctor hears that that patient is not alert and oriented times 4, they have stopped listening to you. They want that patient to come to the hospital. If the doctor says they want that patient to come to the hospital, then we have got to deliver that patient to the hospital. Period. Okay? That liability has now fallen back on us. All right? And we have to get that patient to the hospital. Okay? And nobody is worth losing your license over this. Okay? You guys work too hard to get your EMT basic license. You guys are going to work even harder to get your paramedic. And you're not going to let somebody who's probably off their rocker or not mentally capable of making an informed decision, or somebody that says, oh, I was suicidal 30 minutes ago, but I think I'm cool now, and you're going to let them walk. We can't do that, right? Because if you have that patient that is suicidal and they said, oh, I'm good now, and they walk away and they eat a bullet, well, you just lost your license, my friend. And not only you, but everybody on that scene. The law enforcement that's on scene, the firemen that are on that scene, and all the EMTs that are on that scene are going to be bunkmates in jail. Okay? Probably going to lose your license too. All right? So, if the doctor says they want to see the patient, that patient needs to come to the hospital. Okay? Which means we might have to forcibly restrain that patient in order for that doctor to see that patient. Okay? What we want to do is we want to, we've already made contact with that doc. We want to try to get as many hands there as possible. Okay? We want to utilize our partners in the fire department. We want to utilize our partners in law enforcement. We want to utilize our other EMS services or our other EMS cohorts, right? Our other partners, all right? In order to make sure that we are doing this correctly, okay? In the state of New Mexico, and this is state of New Mexico specific, okay? Specifically in Bernalillo County, okay? If we have somebody, say that you guys, say I'm working for Albuquerque Ambulance, okay? And one of you guys are working for Albuquerque Fire and Rescue. If I get the call or I make the call as the paramedic where I need to forcibly restrain this patient, okay, I can do that as a paramedic in the state in Bernalillo County. If I make that call and I forcibly restrain this patient, I have to have somebody from another agency in the back of the ambulance with me as a witness. Okay? So if I'm working for Albuquerque Ambulance, I need somebody from law enforcement, county fire, city fire, another EMS service, somebody else that's not affiliated with our service to ride in the back with us as a witness. Okay? That's same for AFR, right? If Albuquerque Fire Rescue, their paramedic, for whatever reason, feels like a forcible restraint is needed, and they decide to restrain somebody, they have to take somebody from another EMS agency or a law enforcement officer with them in order to act as a witness. I cannot have two people from the same agency in the back of the rig at the same time if somebody is forcibly restrained. Okay? But again, you guys will get that training when you guys get into your services. Okay? The big thing is that if we do get that forcible restraint, okay, that law enforcement is really the people that are going to be the ones that are going to be restraining that patient, putting them on that gurney and holding them down while we, the EMS people, strap them in. Okay? Then it's up to your paramedic if they decide that they want to do both physical and chemical restraint, depending on what's going on with the patient. Okay? And again, you guys will get a lot more on that once you guys get into your services. Okay, so who has the right to refuse treatment? Okay. Adults with decision-making capacity, period. Okay? It is that easy. If that adult is tracking you and they're conscious and they're alert and oriented to person, place, time, and events, they have the right to refuse treatment. Okay? Now, there's some caveats to that, but let's talk about this for a sec. Okay? They have the right to refuse treatment and transport. Okay? They can withdraw consent for treatment or transport at any time at the EMT basic level, except if you have given a medication already. Okay? I'll come back to that. They can refuse treatment. I don't care what the injury is. Okay? I don't care if it includes that injury might be up to death. You might be going up to somebody that might have been shot 6 times in the chest. If they're alert and oriented to person, place, time, and event, they have a right to refuse treatment. Okay? They have a right to refuse treatment. If you guys walk in on scene and you can see that heart attack from a mile away, and we'll talk about that more once we get into cardiac on the signs and symptoms of that, but you can see them having a heart attack from a mile away, that patient has every right, if they are alert and oriented to person, place, time, and event, and you guys have informed them on their decision. You guys have informed them that, ma'am or sir, if I leave and you do not get treatment, you can have permanent disability up to and including death. If they understand that, they have every right to refuse treatment. Okay? Now, when does a patient not have a right to refuse treatment? Let's say we have that patient in the back of that ambulance, okay? And we are halfway to the hospital. And here we are cruising westbound on I-40, and all of a sudden this dude says, oh, I don't want treatment, after me, as a paramedic, okay, after I have just given them pain medications. They can't say, oh, I don't want treatment anymore. You guys need to pull over and let me out. It doesn't work like that, okay? You guys as basics, you guys really don't work with pain medications in our EMS system, okay? But you guys do have some pretty serious drugs that you guys are giving these patients. If you guys have administered a medicine while in transport to the hospital or on scene with the patient, they can no longer refuse treatment and transport. Period. If you guys give them a medication, they are going to the hospital. Okay? I'm going to say that again. If you guys are on scene with your patient, or if you guys are transporting to the hospital, and you have given a medication, okay? If you guys have given a medication, they are going to the hospital. So let's talk about this even more. you guys can give oxygen. Oxygen is a medication. Okay? They have got to continue to go to the hospital. All right? Please make sure that you guys remember that and understand that. You might see that on a test coming up. Okay? Okay, this is a very important slide. You guys need to memorize this slide. You guys will see everything on this slide on your first exam. This is how a patient is able to refuse treatment and or transport by EMS. Okay, I don't care what level of licensure you are on. I don't care if you're a basic, an intermediate, or an advanced EMT, or a paramedic. Okay, these are the same rules apply. Once you get to paramedicine, there's going to be a couple more added to this, but this is basically the foundation, okay, of what you as an EMT need to 100% guarantee is done for a patient in order to get a refusal on a patient, in order to not take this patient to the hospital, and in order to not treat this patient. Okay, so we need to confirm that the patient is an adult of legal age, okay, or emancipated minor. If the minor is emancipated, they have a card. It's like a little business card, okay? It's got the state of New Mexico symbol on it, right? It's got the name of a judge on it, okay? It's got a 1-800 number you can call to verify that this thing is real, all right? But they will tell you or have some kind of proof that they're emancipated. If that child says they're emancipated and they don't have that card on them, we can't refuse treatment, okay? They know that they must carry that card on them until the day they turn 18, all right? The patient is able to make a rational, informed decisions, okay? And they are not altered by any drugs or alcohol, okay? Now let's talk about this for a sec, right? We've talked about this already a little bit. In order for a patient to be of sound, rational mind, they must be alert and oriented to, what are the 4 things? That's right, person, place, time, and event. Okay? Person, place, time, and event. And not altered by any drugs or alcohol. Now, here in New Mexico, specifically Bernalillo County, we do not have a problem with drugs. Right? No. Nobody out here is doing drugs. Okay? Nobody out here is chugging beers. Right? Nobody. We do not have a drug and alcohol problem out here. Okay? Here's the deal. You guys are going to meet professional alcoholics. You guys are going to meet professional drug addicts. Okay? They could still be altered, but able to answer person, place, time, and event. Okay? If you think that they are a danger to themselves or others because of their alteredness, you cannot get a refusal. All right? So this is something that you might want to initiate if you guys are ever on a basic truck, which means that you are a basic and your partner's a basic, which rarely ever happens in the county of Bernalillo. Right? This might be something that you might want to refer to your paramedic for. Now, some of you guys might get out there, and New Mexico is very rural. Okay? We have a lot of ground to cover. Okay? And some of you guys might go work for a system where your paramedic is 4 hours away. All right? These are what you guys need to guarantee at the basic level in order to get a refusal from your patient. All right? You have performed a thorough assessment of the patient that includes the following. You must do a physical head-to-toe exam. Okay? That means you're starting at the head and you're touching every single square inch of their body, basically making sure that they are not bleeding or that they have no pain from head to toe. Okay? We'll talk about that physical exam later on in this class. Okay? You need at least 2 sets of vital signs. 2 sets of vital signs. Okay? And most of the services require that those 2 sets of vital signs are anywhere between 5 and 10 minutes apart in your documentation. Okay? And that you have done a proper history. Okay? That's what that HX means on the slide there. That's history of the patient. At a minimum, we do what we call a sample. That's a mnemonic. Okay, sample stands for social drugs, allergies, medications, past medical history, last oral intake, and events leading up to the call. Okay, don't worry about that right now. We'll get into that when we go over patient assessment stuff. But you guys will need to know how to perform a sample history. Okay, we need to make sure that this patient is free of suicidal and or homicidal ideations. They don't want to hurt themselves or others. Okay, we have explained the risks of refusal to the patient. We have explained to the patient of what might happen to them if they do not render care, if they do not let us render care, and if they do not let us take them to the hospital. Okay? You at the basic level, okay, you must contact an MCEP. Again, the MCEP stands for Medical Control Emergency Physician. Okay? The MCEP is basically an ER doctor. Okay? It could be any ER doctor. Okay? Usually what you will do is if you're on the scene with a patient, this patient wants nothing to do with you, and they have refused everything in the book that you've thrown at them, and you guys have clearly explained what might happen to this patient if they don't get help. You guys have your 2 sets of vital signs, and you guys know that this patient has refused any kind of suicidal or homicidal ideations, and you don't think this patient is drunk or on drugs. You call the hospital which this patient would be transported to. So that's information you would have to get from the patient. Okay? We'd have to find out from the patient, sir, if I was to transport you to the hospital, which hospital would you like to go to? Okay? At that point, you're going to call the MCEP at that hospital. Okay? You're going to call that medical control emergency physician at that hospital. Okay? And you're going to tell the doctor what you have. You're going to tell the doctor what you were dispatched to. You're going to tell the doctor everything that the patient has told you. You're going to give your doctor the last set of vital signs. You're going to tell the doctor that you are not suspecting any drug use, alcohol, suicidal, homicidal ideations, and you're going to say that the patient doesn't want to go to the hospital. And you're going to ask the doctor, what would you like me to do? Okay? If that doctor says, hey, they don't need to go to the hospital, great. Get the name of the doc and on your way. Okay? Patient signs refusal. Boom. Okay, sir, best of luck to you. We'll see you later. Okay? If not, if that doctor says, hey, I want to see him, or that doctor might say, hey, I want to talk to him. Okay? Let's get the patient on the horn for the doctor so that the doctor can talk to him. But again, you guys will get more training on this when you guys get into your services. Okay? Then we would like to have 2 different sets of signatures, one being the patient and one as a witness to everything that we did. Okay? That witness can be law enforcement. The best witness is a family member or a bystander that might be on scene that knows the patient. Okay? But it cannot be your partner. Okay? Or it should not be another EMS provider. Okay? So again, make sure that you guys know this slide. Make sure you guys know every point on here. Make sure that you guys are able to explain this in your own words, because this more than likely will show up, hint, hint, will show up on your first exam.